excited about this next panel. I'm Megan. I'm with the Health Foundation. I'm the project director for the South Florida Anchor Alliance, and I have a personal passion for architecture and design, and working with the Health Foundation, looking at how we fold in health as a layer to this conversation. And so we have a great group of speakers here today, and I think we've really been leading up to this panel here today. We know that there is a huge need and importance for affordable housing, but there's a huge need for quality housing, and quality designed housing that advances health. And these women up here today, in their own way, are doing just that. Our first panelist this morning, or this afternoon, is Joanna Lombard. She is an architect and distinguished professor at the University of Miami School of Architecture with a joint appointment in Department of Public Health Sciences and the Miller School of Medicine. So she really understands the importance of this intersection between architecture, health, and design. She's worked on research and design strategies for healthy buildings and communities, and she's put together this incredible plan on the Healthy Housing Toolkit. So with that, I'll turn it over to you, Joanne.
Thank you, Megan. And thank you to all of you who are still here today, because it's a long day and we're happy that you're with us, because I feel like you've heard so much about the policy and the framework, and we actually have real projects to show you as to what this looks like. So, yeah. Okay, so I'm gonna go really quickly, and then, because I really want you to see the projects of my co-panelists, and I'm basically just going to give you the framework on the Healthy Housing Toolkit, and then I'm happy to share this with anybody afterward if you'd like more detail on it. I have to show you this because nobody does anything alone. We've heard that all day, right? And this is the team of researchers that I work with, and you can see there are people from parks and cardiology and epidemiology, and my colleague Liz Plater-Zyberg, who's a really important foundation to this project. And the first thing, I don't know if you got this first thing in the morning, but how many of you are aware of the exposome? Okay, it's right up there with LITEC, huh? So the CDC has put this out there, and essentially what it says is that we map the genome, but we live in the exposome. And this is absolutely everything that affects our health. It's our physical environment, it's our genetic framework, it's our social environment. We talked about social isolation being a huge issue, and it's the lifestyle choices we make. But I would submit to you that many of the lifestyle choices we make are determined by that physical environment. And these are some of the reasons why this day is so important. This slide is really showing you the health determinants. So if you look at all of these different aspects, housing is there at the top, but it's one, right? There are also environmental issues, which is where are we building, right? It's do we have sustainable transportation? Can we get around? What kind of social cohesion is in our neighborhood? Housing exists not as a tent in the wilderness, but it's part of a context. What is the public infrastructure? Can we get to school? Do we have hospitals nearby? And then what's the economy of that neighborhood? And so when you take all of those factors and you bring them over and you see how they're in the physical environment, the social environment, the individual's environment, healthcare is one part of it. We may spend 80% of our GDP on, if you look at what's spent on healthcare, it's up at about 80% in terms of health, but if you look at what is valuable in terms of our well-being, it's the health and well-being of an individual, and that expenditure is down around 9%. So we have things a bit skewed when it comes to the environment. So who's applying this? This is a great tool, and San Francisco laid this out, and I thought in a really clear way, and I just wanted to share it with you because they look at what does the city need to do, what does the community around us need to do, and then how do we respond to that? And so this was their plan for healthy housing, and you can look at this more later, but essentially, if you look at it, it's a whole menu of transportation, housing, food, access, safety, jobs. And so this gets to the point that I wanted to share with you, which is one of the groups that can help in this work is a research, right? If you look at that first diagram, that's a study that our team did, and it was funded by HUD, but it was also funded by the Health Foundation of South Florida. And we looked at 250,000 Medicare beneficiaries in Miami-Dade County, and we looked at their neighborhoods in terms of greenness. And we found that the people, and especially in low-income neighborhoods, the people living on blocks with higher levels of greenness had lower levels of disease outcomes. And this was the first part of the project. You can read it on the slide. We then got funding from Robert Wood Johnson to say, you know, Miami had a tree planting program between 2011 and 2016. Could we see impacts in people over time? In other words, if you lived in a low tree neighborhood and you got trees, could we see any health benefits to that? And although this study is the paper under submission, every academic in the room would know what that is, but essentially what's out there right now is that you don't. We saw benefits in terms of Alzheimer's, dementia, heart disease, and depression. And so some of those papers have been accepted, one is still under review. The reason this is important, because I feel like when you asked earlier in the other panel, what kinds of things do we have that prove this? Well, I think that being able to show these disease level reductions is a quantitative measurement that should be added to the other kinds of measurements that people talked about. And then if we take that research, and we're sort of in the policy academia side of it, and we get that information to practitioners who can begin to apply it, then what you see here is Miami's Million Trees program, where anyone in Miami-Dade County can contact the county and say, we need street trees in our neighborhood, and that's actually showing up and bringing them. And that really gets me to, so what does this look like in terms of a healthy housing toolkit? This is work that we did with the Gorman group and at DPZ, and what we found are there are certain, I don't know if that's too small or if you can read it or not, but I'm happy to share it with you, and they gave me permission. But essentially we said there are certain things that are unique to each neighborhood, and getting those right is extremely important. But there are certain overall things, and when you look at sort of transportation and mobility and safety, there are things that need to be provided by the neighborhood, by the site, by the building, and in the unit. So if you look at what's in the unit there, it'll be access to daylight. All habitable spaces have access to daylight. That may sound like a no-brainer to you, but many buildings will have service spaces and things like that that don't, and that's where you create unsafe environments. Issues of safety. This was done for an urban neighborhood. So if you look at this one closely, you'll see that we're talking about first floor retail. We're talking about a building that's for housing, but it's providing mixed use as an opportunity to create safety on the street. So if we look at what does that look like when you build it? This is a DPZ project in Tavernier. Now, this is very different because one of the ideas here is that wherever you go, you need to be part of the neighborhood. We didn't talk about this so much today, but sometimes people don't want affordable housing in their neighborhood because they think it looks different. They think it's a different kind of model. But if it fits in the neighborhood and people are proud of it, it works. And this brings us to our community engagement, which I'm going to talk about in a minute. The last slide I wanted to show you, this is a student project. Tiffany Banks is an architecture student. We were working in Northwest Lake Wales with Victor Dover, who's doing some amazing projects there. And Tiffany actually entered this in the Metro Lab Network and won in the Health and Wellness finalist. And if you can see on the slide, what she's doing here is she noticed the lots in this Northwest historically black section of Lake Wales are very thin, but they're very deep. She said, what if we restored the original alleys, and if the homeowners could replat, and they could build an accessory unit, or sell that piece of property on the alley? And what if we introduced retail at all the corners? Could we bring people back into the neighborhood and increase the economic value of the properties? And the Lake Wales Council actually said, this is a really good idea. This is a way we can integrate affordable housing. And I show this to you because I think it's very important to understand there are micro-scale things in addition to the big topics that we've heard about. So what I would leave you with are three things. First of all, this really is, housing is part of an ecosystem. And we are responsible for all the different parts of it. And to all of you who are here, who are these great partners from all these fields, this is how we're going to come together and create a healthy ecosystem for housing. And this is what these women with me today have done in their communities, some of them here. The second And this, I think, is also important, the team. Who is the team? It's not just an architect producing a building, or a funder, or a healthcare group. It's actually coming together. So I wanted to mention to you a project that we worked on in Richmond with the Richmond Redevelopment and Housing Authority, Bon Secours Health System, and DPZ worked on this. We brought the research to them. They were looking at the east end of Richmond, and the people that came to the table are all the usual suspects, right? Everyone that you would imagine that would come to a community charrette. But we really believe in a youth charrette. And that's the one thing I maybe didn't hear so much today. So we gather, and our youth charrette has children as little as 4 and people in college. And we ask them, what do they want their neighborhood to be? And one of the things that's really great about a youth charrette is that they give you their ideas. So a number of things came out of this. And this is, I think, also important because the hospital, Bon Secours actually was the partner so that Richmond could go for LIHTC funding, and they would be able to initiate the first redevelopment of this project, Creighton Court, which had something like 500 units built in the 1950s. There was a child from Creighton Court, 10 years old, and he told us what he wanted was an address. He didn't want to tell his friends at school, I live at Creighton Court. He wanted a number and a street. So one of the planners said, okay, and he sits at a table and he starts figuring out how Creighton Court could actually be very easily turned into blocks and streets and integrated into the neighborhood. That part of the project did not go forward because the Housing Authority had a big idea for the LIHTC funding and really redoing Creighton Court. The hospital was going to do a big building, and the children said, you know, we just want an ice cream stand, right? So the hospital starts to realize, well, you know what, we could start seeding businesses. So they gave $5,000, $10,000, and $15,000 grants and started seeding businesses all along 9 Mile Road. And then they redid a community center, and essentially, and they brought in a grocery store because everybody wanted a grocery store. That child is now 24 years old, and Creighton Court hasn't been built yet. There's a first movement on it, but between the LIHTC funding and the processes that take place, it's really complicated. So I would submit that sometimes you don't have to go through the whole thing. Sometimes you could make someone's life better at a smaller scale. And so that's where the voices at the table are really important. And they should include people that you may not have thought of, including 10-year-olds who live in the neighborhood.
Thank you so much, Joanna. Our next speaker is Kerry-Ann Royce. She is the president and CEO of the YWCA in South Florida. With over 100 years, has focused on systemic disparities experienced by women of color and addressing those disparities through education, health, wealth building, childcare, and housing. And I'm really excited to hear about the projects today that Kerry-Ann has been working on, and really looking at how you are taking into consideration the needs of the community you're building into the projects that you're proposing.
Thank you very much. First of all, big shout out to everyone who's still here. You are the MVPs. Woo! You made it. So thank you for being here. As mentioned, my name is Kerry-Ann Royce, and the YWCA has been around for 104 years. It's a W in that YWCA that makes the difference, right? And a lot of folks get our mission mixed up with, the other folks. I don't know them. And our mission is to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all. We are a social justice organization, and we've always been built as a social justice organization. Lots of words here. Basically, what you need to know from this is that it has been in our DNA as a YWCA to house women. We have housed the wives of servicemen. We were the first to provide childcare in the 10 cities during Hurricane Andrew. We housed what we used to call working women, we don't call them that anymore, which was young women who could not live on their own because in your 20s, during the 40s and 50s, that was not appropriate. So we owned hotels up and down Miami Beach, which someone sold, and I won't find out who that was. And we housed many women and we taught them secretarial skills and other working skills to be in the community, and to be self-sufficient. But more importantly, you might know across the country, YWCAs are one of the largest organizations with domestic violence shelters and other kind of supportive living shelters across the country. We have and have always considered ourselves to be the champions of women of color. We are led by and led with and for women of color. So to be around for 104 years, you can imagine that you can't do the same thing every day, all the time. You have to challenge yourself. You have to talk to your community. You have to be with community. One of the things we have really, really prided ourselves on is that we've made our home in community. We were one of the first social services organizations to make Overtown our home. We live in Overtown. We've been there for 30 years. We serve Dade and Broward counties. We have another YWCA in Miami-Dade, and people say, well, what do you do there? We do not have any pools or any gyms, boys and girls. We do only social justice. What does that look like? So our commitment to opportunity has engulfed over these years, reaching over 4 million lives. We have graduated entrepreneurs. We have over 100,000 square feet of community space throughout our community. That means land, buildings, preschools, other shared spaces that we have in and around our community. And we have reached over 23 states with our different virtual programs, and not to mention, we have breast and cervical cancer programs. We have court programs where we're in the courthouses, making sure that women can protect their God-given human rights and their safety by not having to worry about childcare. We are in the courthouses in Dade and Broward counties, and we have 4 preschools. And of course, my watch and my husband decides to call me right now. So over this time, we said to ourselves, well, if she is our avatar, if she and her prosperity is our North Star, what do we know about her, and who is she, and what is she striving for, and what obstacles stand in her way? And how do we best make her and her family healthy? And I can tell you all the statistics about the fact that Black women, women of color, women who are single heads of household drive our communities. During COVID, we all saw it. We all saw the folks who had to go to work because they are the people who care for us. They are the people who care for our elderly. They're the people who care for our children. They are your pharmacists and your preschool teachers and your teachers, right? The folks who can't stay home. And what do we also know about them? They're spending almost 70% of their income on childcare and housing. We know that there are 75% of single women heads of household are living paycheck to paycheck or below. 75% in Miami-Dade, that's 3 in 4 women single heads of household at one paycheck, one blowout on a tire, one sickness, one kid getting sick and having to stay home, one issue away from that happening. So when we think about and took a step back and said, what is the greatest asset that we have? Doing programs is great, and we will always be a program organization. But if you're not changing the systemic issue, if you're not looking at the groundwater, if you're not going upstream and saying what is causing the issue and how can we dedicate and recommit the highest and best use of who we are to those solutions, then truly we're just throwing the fish back. So our question to ourselves and the challenge we made to ourselves is what did all those things that I just listed, what does it allow us to do in solving some of the greatest issues that Black women single heads of household are facing today to make their families healthy and thriving? We have space. We have land. We have buildings. We have programs. We have a mission. We have a brand. We have things that we can leverage to solve bigger systemic issues. And we believe that space matters. We believe representation matters. Space is social well-being, it's emotional well-being, it's physical well-being, it's economic well-being, it's community well-being. So our approach to housing thinks about her. It's healthy housing for her. And along the lines of building that and those solutions, guess what? There are a bunch of other people that can line up and benefit from it also, right? But I'm thinking about her and her lived experience. So over the next 5 years, YWCA will be building over 500 units of, I don't want to say just affordable housing, but accessible housing that is affordable. So that means, thank you very much, we're going to protect affordability, we're going to embed childcare as a part of the response. We are going to make sure that these housing units are also mixed income for social integration as well as for economic inclusion. One of our previous panelists mentioned that, right? That social and economic inclusion has been proven scientifically that it changes the outcomes for generations to come. And it's one of the only things that have been proven to change outcomes. Not to mention, let's be honest, it makes the economics of building these things a little bit better if you have mixed income, because it's taking hopefully not 17 sources of funding like we heard earlier, right? But it takes a lot to get these things built, especially in divested neighborhoods like Overtown and Miami Gardens. So we are hoping to build open and magnetic open spaces so that we're building kind of community pride, economy, and just the energy that should be brought into neighborhoods that let everyone feel like, man, I feel so much, I see who I am and who I can be reflected in the spaces that I'm in. I tell people all the time, remember when you first walked onto a college campus? That feeling, kind of like, oh, this is me. This is me. And everybody, you got a shirt to wear too that said, this is me, and they give you a card that says, this is you. We should all know that feeling. And spaces reflect that. Spaces are powerful. So we will also embed our economic mobility hub, which is everything from building entrepreneurship, workforce development, learning about financial literacy, and that starts from teens and carrying on. But what we're seeing then is that we're going to have all incomes working together on their goals and being able to get those surround services. We're dreaming big. So this is kind of the visual, beautiful rendering, very first draft, very preliminary, oh dear God, please, of the vibrancy of how our spaces should look and could look and deserve to look. And we are building this on the west side of Overtown, which if you've ever been to Overtown, you know the east side gets all the love. And the west side's like crickets. And we're gonna reconnect what the I-95 and institutional racism divided. We're gonna reconnect Overtown through what we anticipate will be a very vibrant community space. We're doing this in partnership with Persida, who did this beautiful design, as well as our South Florida Land Trust, Community Land Trust. Mandy is not here today, but I'm gonna shout her out because she bought the lot next to our block. So we're redesigning the block together. We are also redeveloping 5 acres of land in Miami Gardens that was given to us by the city of Miami, by the county about 4 years ago. So the entire model continues to work together. But we ask ourselves, and here's a question that sits out there, because I'm a social justice leader. That's what I do. I didn't go to school for real estate. I don't know how to build these things. I'm learning live tech and 9% and live local, and choosing developer partners and RFPs and arguing with attorneys and for-profit developers. I'm growing like all kinds of new muscles. And I'm a solid B+ at this now. No, maybe B-. Be honest. But this is how this space and moving into what's necessary for community to grow, it challenges us to show up differently. And we own land in Miami, in South Florida. What better use of it? But it takes bold leadership, and it also takes continuous learning, and it takes understanding where these sources are, but it all starts with how are we responding to the needs of our local community, to what we know health looks like, because space and housing and all of it is health. Was I supposed to be watching that clock? Because it says 0. Okay.
As the last panel of the day, I think we have unlimited time.
Okay. So, courage, compassion, and commitment are our 3 C's at YWCA. We are a bold mission, and it takes strong leadership and bold mission and risk in order to realize true health into the future.
Thank you, and that truly is a beautiful design, and I really want to amplify a comment that you made, is that you're building a thriving community. And as a project, a community-based organization that's going into a community that has been heavily disinvested in and building a new housing project, you also have the opportunity to build up that community and to build a space where the residents around the area also get to enjoy it. And the residents have pride in the house that they live in. And so I think that's an important piece when we talk about healthy design, is healthy communities.
Very true.
Well.
And I just want to say, shameless plug, it's necessary to get all the regular kinds of funding and do all the things that need to be done. But the organization that we are today has to be a vastly different organization in 5 years when this is built. There are things we don't know how to do, that we have to build our capabilities to do, and we have to constantly tell people and put that story out there and say, walk alongside us to build that. And I want to give a shout out to the DeLuca Foundation that has made the first commitment to the YWCA to build our capacity to do this work and to be ready in 5 years. But capacity building that has nothing to do with the housing itself is what is going to make it successful to create communities that are powerful.
Great, thank you. And you know, unfortunately, we don't always have the opportunity to build new projects in the communities that need them. And we actually have an opportunity to rehab the existing affordable housing stock that's there. But we have a responsibility to make sure that that rehabilitation is also done in a conscious way, where we're building back quality into these houses for the residents that live there. So with that, I'll turn it to our next speaker. Her name is Martina Spolini. She's the Executive Director of Rebuilding Together Miami-Dade and is a passionate advocate of affordable housing, disaster recovery, and community revitalization. With a distinctive perspective shaped by her experience in over 6 countries, spanning 3 continents, Martina contributes a unique and global understanding to the housing nonprofit realm.
Hello? Yes. Thank you so much. First of all, my mind is blown. I am so honored to share the stage with such a group of impressive women. And thank you for being here. I know it's late, you've been here all day, so again, shout out to you. Here has slides. My name is Martina Spolini. I'm the Executive Director of Rebuilding Together Miami-Dade, and I'm here today to tell you what we do and how we incorporate good design practices to build or rebuild healthier living spaces for lower-income communities all over Miami-Dade County. So we're a housing, community revitalization, and disaster preparedness and recovery nonprofit that's been doing work in Miami-Dade County for over 30 years. We were born in the aftermath of Hurricane Andrew, and since then we rehabbed completely free of charge for our service recipients over 1,400 single-family homes, 38 between small businesses and community spaces, and we invested more than $21 million into making Miami-Dade County housing safer, healthier, more accessible, and more affordable, one free repair at a time. Thank you.
Did you say free repair?
Free. So our service recipients do not pay for these repairs. And when I talk about repairs, we're talking about critical repairs for healthy homes. Anything from a new roof to impact windows and doors for older housing stock to make it more resilient in the wake of natural disasters. Then we do a lot of interior repairs, accessible bathroom modifications, kitchen remodeling, HVAC, mold remediation, anything really that we identify in a home that's needed to make that environment safer and healthier for the people living in it. So the way it works is that 100% of our service recipients are low income. Once a household qualifies for our services, we go out and we assess their property. We go by a list of 25 priorities. So we look for hazards that are present in the home. Hazards like, is the home watertight? Is the roof leaking? Is there mold? Are there fire or electrical hazards? And then we build a scope of work and a budget. And if funding is available to cover all of the repairs that we identify, we move forward. Otherwise, we take care of the most critical repairs so that the families we're working for have a safer and healthier environment to be in. So I think the best way to really showcase the type of work that we do and how we incorporate good design practices is to show you before and after photos of some of the projects that we completed over the past couple of years. This is a before photo of a kitchen of a home where we did extensive work over 4 years. This is the home of a veteran. She was born and raised in this home that had been purchased by her father for her mother and passed on to her when the parents passed away. The house was ravaged by a terrible electrical fire, and the house was absolutely uninhabitable. There was a gaping hole in the roof, so water was coming in, pests were coming in, there was mold everywhere, the kitchen was not functional, and because of that, she was not able to cook healthy meals. So for years, she resorted to cooking in a microwave, ultra-processed food that deeply affected her health. So thanks to the support of amazing corporate partners, we were able to rehab the whole home, and you will see more photos later on. So new roof, new insulation, drywall, flooring, electrical, plumbing, and kitchen. It took 4 years. In this case, this is a kitchen after, and we implemented very good design practices because we wanted to optimize the space. We wanted to make it functional, we wanted to make it beautiful. She loved to cook, and so we wanted to create more counter space. We put energy efficient appliances, and we know, because we were in this home for 4 years, that because of that, because of the energy efficient appliances, her utility bills decreased over time. We also used more durable materials. And those two, there's this misconception, right, in our line of work that good design comes with a very high price tag. That doesn't necessarily need to be the case. But also, if you look at the long-term investment, when you use better materials to build or rebuild, there will be less maintenance costs, maintenance expenses in the long term. Here is another kitchen that we rehabbed. This was the house of a single mother with several children. As you can see, there were electrical hazards, there was no flooring, there was mold in this home too. So we came in, did flooring, countertops, backsplash, appliances, anything to make it a safer and healthier environment for this family with children to live in. And then again, the best way to showcase the type of impact that we have on the families that we work for is to show some of the most common interior repairs that we do is bathroom accessibility modifications. And this is where you can see good design at work. This was the bathroom of an elderly couple. They were in their 80s. They didn't even have a tub. They were bathing using that bucket. It was extremely unsafe, extremely unhealthy. No one should live like that. So we came in and redid the whole bathroom, did a walk-in shower, and something we are very proud of is that we work very closely with the families that we serve to meet their design needs, their taste. So we're lucky to have a network of contractors because all of these repairs are done by licensed contractors, of course. Our contractors have been working with us for years, and I totally understand the vulnerabilities of the families that we work with, and so they go above and beyond to meet their demands, to meet their wishes. Here you'll see another bathroom remodeling. Whenever possible, we do tub conversions to walk-in showers because we do not believe in Peter Pan homes. Peter Pan homes are homes that don't age with us, but we're all getting older, and the vast majority The vast majority of our service recipients are elderly people or people with mobility issues or disabilities. So we want to make sure that they live in environments that are healthier, safer, and more accessible, so they can use the bathroom independently without any risk of slipping and falling. And this is, again, the same house of the veteran whose kitchen you saw earlier. So here you can see a part of the damage that was done to the ceiling. She had no insulation, which translated into no air circulation. It was very unbearable during summer to be indoors and very unhealthy. There was so much mold. And another issue that she developed because of the unsavory health conditions and living conditions was asthma. And throughout the 4 years that we were in the home, she reported back that her healthcare-related expenses decreased significantly because we did a mold abatement and we put insulation and a new HVAC system. So we removed that hazard so that she could live a better life. This was one of her bedrooms. And here I have just before of a roof. Roofs are one of the most expensive repairs that we provide, and the cost of roofs has significantly increased since COVID. But we are invested on replacing as many roofs as possible because the homes we work in are older homes, and we want to make sure that they are ready for the next natural disaster. If we invest in prevention, disaster prevention, we will spend less money in disaster recovery and rebuild. So this is the after photo of the same home with a new roof. And the last two images that I have for you are, this is a small business. It is a bookstore in Little Haiti that we completely redid. The owner wanted to create a better and more welcoming space to host events. So we custom built the new bookshelves so that they could organize the books by genre. And then we painted the walls, new furniture, new flooring, just to make it a much better, more welcoming environment for the community. And the very last photo, this to the left, was the room of a veteran organization in Opalaca. They have a facility and they had this room. They didn't have the financial ability to take care of all the repairs that were needed to make it a safer environment. So you see there were holes in the ceiling, electrical hazards all around. And we turned the room into a therapy room. So they were able to partner with a therapy group that does free therapy for veterans. And we flipped the environment completely and tried to optimize the space as much as possible using warmer colors and light because there was no natural lighting in this room. So this is a little example of what we do, and I'm going to leave you with the quote of one of our homeowners. On average, we serve 80 households per year, so around 230 people every year. And again, our homeowners, our service recipients do not pay a single dollar towards the repairs that we provide. They're provided absolutely free of charge. Thank you.
Wow, those are some really powerful images, and you mentioned something that seems so obvious now, but when you don't have access to a kitchen, you can't cook healthy meals for yourself. And so being able to provide a space that encourages cooking, it encourages families to gather around the table, you're not only addressing housing insecurity, but food insecurity issues as well. And I just wanted to bring that to light because I think that it was just one of those moments for me. It's like, wow, right? So our next speaker today, I'm stuck here in the carpet, sorry. Our next speaker today has just really continued to impress me with every conversation that we have around the projects and innovations that she and her organization are doing around building green, affordable housing. I have never seen anything like this before, and I think you all will be equally as impressed with the standard that Sherry and her team are building around what you can do with green, affordable housing. Sherry Taylor is a real estate developer, urbanist, panelist and the executive director of the Durham Community Land Trustees. Her interests include innovative development and working with partners for more holistic housing.
Good afternoon, everyone. I have the momentous task of being the last panelist and closing out this great summit. Again, from Durham, North Carolina, just a few hours north of here. In North Carolina, we have 4 seasons, and apparently I brought the cold with me. Apologies. But we do have a lot of things in common, and that's being in the South, the humidity, and the other kind of Southern-related construction issues that we have. But I'm really excited about this topic because I know it through lived experience. Just quickly, sometimes you read things and you know them from a book knowledge, but a few years ago, my 70-year-old parents came to live with me, and my mother could not do the basic tasks of daily living independently, getting dressed, showering, that sort of thing. And I was like, cool, we got this. Live in a ranch, there's only one step to get into the house, this is gonna be fine. Well, let me tell you, my oasis turned into something else completely. I found out very quickly that the hallway was too narrow, the doorways were too narrow, and the bathroom, forget about it. It could not accommodate a mobility device. And so my lovely ranch home became very stressful. And that's one reason why when we talk about health, yes, we can talk about, sustainability, but we also have to talk about accessibility. So again, Durham Community Land Trustees is located in Durham, North Carolina. We are a permanently affordable housing developer. Permanently affordable is important. That means our units stay affordable forever. So we're really interested in the longevity of our houses, not just the longevity of the materials that we use, but also how useful they're going to be. We're the second largest provider of affordable housing in the city of Durham. We have nearly 200 units of rental housing, and we also provide homeownership opportunities through the land trust model. And I won't get into that, but basically, we only sell the structure, and the land trust owns the land. Every time that house is resold, it's resold to a family that's low or moderate income, 80% area median income or below. We also own a few community gardens, and we're doing a couple other good things as well. But DCLT is a urban infill provider, and we work in neighborhoods that are historically underserved, neighborhoods that are majority minority, low income, and we do work like this, and we've been doing this since 1987. With the dual benefit of having, affordable units, but also doing neighborhood revitalization. This is just a picture of a project we did in 2018. We did 6 houses in a row, and the majority of our units are within the neighborhood, right? They're small scale, they're single family homes, duplexes, triplexes. When people ride by our houses, they don't know they're affordable housing. They think they're market rate housing just like everything else. But it's because of design choices. So this is where we started. And most of the houses that we rehab, we also do new construction, but most of the houses we rehab are from the 1920s and 30s. So I just want to stress here that when you're dealing with older homes like that, you have lead, asbestos, mold, rodents, those type of things that you're dealing with. And yes, that is a part of healthy housing. But there's a whole spectrum from lead and asbestos to deep green housing, and that's where we are right now. Along the way, we've done some other things. Before we got into deep green housing, we tried some other things. Environmentally sustainable housing, steel frame construction. The little picture on your left, right, depends on where you're sitting, shows you that a house can be framed up out of out of steel. It doesn't have to be framed up out of wood. Steel is more durable. It's fire resistant, moisture resistant, storm resistant, and we have some lovely things here in the South that love to eat wood. Termites, powder post beetles, other little insects that just tear up a house. And you can get away from that with steel frame construction. These houses also have passive solar, which means that the light comes in, it heats the floor, and that's radiant heating for the occupants. That means that our owners and our renters are paying less towards their energy bill, and it's also great for the planet. Can I tell y'all a secret? Promise you won't tell anybody. Okay. We have about 45 units of passive solar rentals. Everybody hates them. And we won't be building anymore. We'll do solar, but we won't be building anymore because they're not culturally sensitive to the people that we serve. Leaving your windows wide open, blinds up, curtains open is not something that we do. And I say we as being part of the African American community. We're not doing that. So none of my residents actually use the passive solar because it feels insecure. It feels like they're leaving their home open for everybody to see. So I just want to say that even though some of the things are healthy, are great for the planet, you also have to design for the people that you're serving. And if passive solar or some other design element does not work for them, is culturally irrelevant, skip it. It's okay. All right. So we have 3 guiding themes that really guide our work at DCLT. And I'm going to share 2 of them. One of them is being sustainable and accessible. And I mentioned that there's a spectrum. You do not have to go deep green on everything, but if you really kind of think about it, you can incorporate accessibility and sustainability in our work. And I say our work because I'm part of this design and development community, and we have to actually demand more, right? 1 in 4 American adults have one disability. That number is only going to grow. But guess what? The federal government, their minimum for accessible housing is 5%, right? So if you have 1 in 4 adults, that's 27% have one disability, and you're only building ADA accessible units, you only have to build 5%, that math doesn't really work, right? So I'm gonna give you, just show you an example. People always say, well, it costs more. And sometimes it does cost more, but sometimes it doesn't. It's just about the design. And I mentioned my mother in the bathroom. Well, this is an example of a bathroom that, the before doesn't work. It's not accessible. There's no turn radius for a mobility device. It's got a tub shower combo that doesn't work if you have mobility issues, right? Being healthy also means that we have to think about fall prevention, right? And the bathroom layout on the bottom has a pocket door, has a turn radius. It also has a walk-in roll-in shower. I also want to say with this, a lot of times if you just design it right, you're not going to pay more. Or if you pay more, it's just going to be a little bit more. So the difference between a 30-inch wide door and a 36-inch wide door is livability and about $300. It's not that big of an issue, right? So if you have to put light switches on a wall, make them lower, right? Make them chair height. It doesn't cost any more, but we have to demand it and put it in the specs. Again, if you have levers instead of doorknobs, that's more accessible, right? A lot of times these small design choices don't cost more or only cost a little bit more, but can really increase the livability of these houses. Our second guiding theme is maximizing our properties for community benefit. What you're looking at here is 2 duplexes that we own side by side, and in the front we have a very large community garden. We said, forget that amazing grassy lawn. We're going to turn this into a community asset. We have 7 beds that's open to the community to plant or harvest, a couple of fruit trees. But we also know that these 2 houses sit within a community that does not have a grocery store within a mile and a half, right? So people have to go very far to get healthy food. we're helping that with our community garden. Secondly, in the South, we have some climate issues, and that's putting it lightly, right? So our climate threats are extreme heat, flooding, and storms. We understand hurricanes in North Carolina too. So by putting in green infrastructure improvements, bioswales, rain gardens, rain cisterns, that sort of thing, we are actually slowing down the water before it floods the street. And these are improvements on the outside of the housing that actually benefit the whole neighborhood. So those are just some of the things that we're doing. Like Kerry-Ann, we own a lot of land. And as an urban planner, I'm always thinking about how else can we use this land to benefit the entire community. When you're designing for health, I want you to think about things like ADA accessibility, making sure interiors are adaptable, daylight. A lot of affordable housing does not have enough windows because windows equal money. Well, windows also equal health. People need access to the outside. Ventilation is also important, that outside air, designing systems where it can actually get in and be fresh. And again, avoiding materials that have forever chemicals in them. Some of you have heard about PFAS. It's like 4 very long words that I cannot pronounce. But basically, those are the forever chemicals that are in vinyl, that are in the glue in LVP flooring, that are in carpet, that we never see, but are actually, changing the endocrine systems of people who live in these houses. So again, you don't have to do deep green to make different choices. All right, so this is our Alma Street Commons project. This is the first project, this will be the first project in North Carolina to be certified as a Living Building Challenge, certified building for affordable housing. We're gonna be building 3 duplexes and 2 accessory dwelling units in a majority minority neighborhood, one that has a lot of environmental justice issues and poverty as well. Sustainable housing should not be reserved as luxury housing, right? Race is still the most predictive factor of someone living near contaminated air, water, or soil. In this community, there's contaminated water, and there's contaminated soil, and there's contaminated air. They got the triple threat here. So building this type of housing is actually restorative to the larger community as well. Americans spend over 90% of their time indoors. So thinking about materials that do not have chemicals in them is huge. So going after LBC is a little bit crazy. LBC is like LEED, if you heard about LEED. LBC is like LEED on steroids. The fact that, a small community-based organization in North Carolina wants to do this is a little bit crazy. But I've convinced my team that this is a worthy endeavor, right? Again, they're going to be permanently affordable, and we're going after this LBC certification that also includes not just green construction materials, but green building. Let me go into that. So green building is thinking about the construction materials, what's going on the outside, and how you deal with construction waste. So to achieve LBC, we have to be net zero, we have to be regenerative, we have to produce more energy than our development produces, and we have to reclaim water on site. That means all the water that's discharged from this development is going to be clean, which is huge because this water flows into a watershed that goes into a drinking source for 1.5 million people. So it doesn't matter that you don't live in East Durham. You're drinking East Durham's water. Whatever happens there, the whole metro area is drinking it. And so when I talk about health and housing, we have to think about, the larger picture. what this means to our larger community. What I love about Living Building Challenge, although it's very challenging, is that it's more than about the building and the materials, it's also about the community. There's a community engagement requirement, there's an equity requirement, there's a beautification and happiness requirement. And so you don't often see those in green construction certifications, but LBC has that, and we're gonna meet it. Because DCLT is the type of developer that develops with the community, not just for the community. And because we're community-based, we're still in the same neighborhood where we started, my residents can come and knock on the door and tell me when we're doing a good job or tell me when we're not doing a good job. And I don't really want any of that smoke. So again, I hope you got something out of this presentation. It was great being up here with these ladies. And I thank you so much for giving me the opportunity.
Okay, that was wonderful, and I could easily sit up here and ask 1,000 more questions than I already have since we've all gotten together planning this summit discussion. But I do want to take this opportunity. We just have a few minutes left to see if anybody in the audience wanted to engage with it. Oh, great! Got some good hands. All right.
Hi. Oh, sorry. Excuse me. Hi. Good afternoon. Is it me or somebody else speaking? I'm good? Awesome. I first just want to say, in the planning for the next summit, please put this kind of panel first. Please. The information that all of you have touched on really speaks to the paradigm shift that we're all witnessing in the human collective consciousness right now, which is to stop siloing the issues that are impacting our health from the mental, the spiritual, the emotional, the physical level, and to really start building with the seed in mind that we are building for the human being, right? So, thank you, right? And I really just want to also say that I appreciate so much in what was just said about the building of urban micro-villages. We live, especially in Miami, we live in incredibly isolated ways. People don't know their neighbors, they don't care about their neighbors. Emergencies happen, people panic, nobody knows what to do. And I think it's really having a huge impact on who we are as a collective, right? And so I don't have any questions, I have just infinite gratitude for everything that you have said. Thank you.
Well, they say they always save the best for last. It's a pleasure to see you, madam. The YWCA I lived behind for about 12 years, so I had the opportunity to watch it grow in my lived experience. I'm on my 5th move in 4 years because some of the places that I've inspected, tested the soil, lost neighbors, and have helped women move out of, despite that, through advocacy, through outreach, through inreach. But I do remember you keeping your door open, madam. So I'd like to give you an extra hand for going that extra mile, for proving that women in Overtown were professionals. I am Madam Renita Holmes. I'm the executive director and executive founder of Wave of Women in Public Housing. My experience, or my lived experience, you know, as a low-income woman of color, goes all the way back to 1986. It's been hell. But currently now I'm on a tour instead of just being homeless and moving in and out of places and navigating this system which seems to have no insight. Although I feel like a talking lab rat, I've since moved away from the area, but I always visit home right next to I-95. One of the biggest issues I had was that people did not see me more than just a resident or tenant. They did not know that I was a subcontractor. They did not know that I'm a Brownsville technician. They didn't know that I was testing the soil. Management didn't know either, that's why I had to go. They did not know that I was in law school. So throughout these things, I've come to this point of now creating a toxic tour because we have been addressing the impact, the health impact of climate gentrification. I'm not a bragger, I'm a doer. I'm one of my best mentors sitting right next here, including you, because you took the time when I asked these questions. All of you spoke a position in my lifetime, and that's on something only a woman can do. But to have that courage to talk about it, like the sister says, I'm just rejuvenated. In December, there will be a toxic tour. Because of my over 38 years of advocacy as a tenant and still low income, I decided to do some mapping and tracking. I decided to hold some landlords accountable as a member of Smash and Lombard. So I live the process, I live the system, I live now to show people the power of a mother in public housing, particularly in Overtown, to participate in a process regarding climate gentrification. So I have one question, if I may, and thank you for listening. Do you have anything in regards to climate gentrification and the impact? See, they're stopping me from taking climate gentrification. The BBC recently did a tour with me as well, and a lot of insight. And as one of the 100 resilient women in United USA, which I have now been nominated and chosen, I plan on taking that message. There are women dying and children dying in rehabilitated units. I would love to have you discuss that. So how do you feel about the impact of climate gentrification on women of color? This is not just for you, madam, although we know you very well. Don't think that the women in the neighborhood don't know you. The YWCA has been a centering point for single mothers and young mothers, and it still remains that. I'm just hoping most of that new housing, or all of that new housing, goes to women of low income. Not just a small, tiny percentage, not just what HUD regulation says supposed to do, because we've built, as a poor woman, as an African-American innocent woman, I've built a lot, but I've been gentrified out of many neighborhoods where they have built things that sound good. I'm still affected by mold. I now have mold disease, to make it easier than quoting mycotoxins of 30 different allergens. So I understand that, but climate gentrification means a lot more to me than sea level rise. It means a lot more to me now when you're talking about housing. And I actually inspect housings after housing inspectors have inspected housing, and women with sickle cell, we do not allow them to have to move into those places. So I want to know, climate gentrification has impacted the hell out of me, but it's only made me stronger. I yield my breath, and I also bow down and say hello to you, my sisters, because you have spoken the lives of a lot of moms I tend to. I do an average of 9 a week without funding, as a landscaper and as a consultant. So this has purpose for me. But what you all did was just describe what I'm going through in the climate gentrification, and I'll yield again to you, because that's what we want to know. Mm-hmm. When are we going to consider climate gentrification in development of housing, new or old?
Thanks for giving her a round of applause, because she does. And I've been wondering where you were. You moved, because I haven't seen you in a while.
4 years, because I require a higher quality housing.
Well, there you go. She had moved. I think one of the most powerful things, and you are right, in the sense that we have options for our land, right? We have options as to percentage and how many bedrooms in a unit and how things are built. We're led by the mission. This land doesn't belong to me. We're a nonprofit organization with a mission drive. The land belongs to the community as far as I'm concerned. So I'm just a steward at this period in time. Our mission is for her. Therefore, regardless of the mix of income, the vast majority of the units and the vast majority of the housing will be dedicated to families, women, single heads of household, affordability. I think one of the most powerful things we could do for climate gentrification is to protect the land and the properties that are being gentrified for communities and generations to come, which is what the Community Land Trust does, which is why partnering with the Community Land Trust, specifically in Overtown, allows us to protect the affordability for generations to come. And why it is important that nonprofits are doing this work of building housing as well, because we're gonna lead people forward. We're gonna protect people forward. And we're going to do things that are so smart with the partners around us, because we have to be aware of all the moving parts. There's so many things happening in Overtown around us that's already in motion. So we have to be aware of all those moving pieces. But I continue to educate myself. I can't say I know everything about it, but what I do know about climate gentrification is that we have to protect affordability for generations to come, so that people like yourself
can stay in your neighborhood and feel healthy in your neighborhood through that course.
Profits. And I am a not-for-profit as well as a for-profit, you know, but not necessarily moving into places, still living in the van outside. I'd like to show you my new storage sections, if you like. So evidently the system still doesn't understand women like me, or tenants like me, or women of low income like me, and now even my HOA and condo owners of color in various places. That's why we have the toxic tour. I guess to bring it up, and I'm sorry, but it's important to me because it's as real as you sitting there and as real as that van outside that I'm still living in, the retaliation that you get for being so very honest. I joined the NAACP, but who holds developers, property managers accountable? Because the last time I checked, public housing funds, federal funds target women like me, seniors like me, person with disability like me, women veterans like me, and I still see the disparity. But most of the organizations that I go to, except for Homes for All, they've always opened their door. Even when I had a backpack, I would lay down on their sofa and say, how many women came in today? Have you seen them? Can I get to them? So I would specifically like to ask you, you know, how do you measure your accountability? How do you balance your ethics? And what do you need advocates as articulate as I am to do to help you?
That was quite a question. But I'll say this. How do we hold developers accountable? That's a great question, and I don't know the answer to it. What I can tell you is that there are developers, especially nonprofit developers, that have a different mission. A mission to actually be with community and be led by community. I think that's a way to get around that. So at DCLT, our board, 66% of our board are community members, and that makes a difference. We're not a board full of corporate representatives, right? So like I said, we're still based in the community, and I don't want to be caught outside like that, you know? So we have to develop with our community. We do a lot of planning and engagement beforehand so that whatever we're building has been checked, has been approved. It's stuff that people actually want. A lot of times I think that folks know from their experience what's happening in their community, what's making them sick, but sometimes they need a nonprofit partner to come along with them and be able to get that message out in a wider way. And it's up to us, the nonprofit developers, to really do that. As far as accountability, we self-manage our rental units, and so that's how we're held accountable, because we do it in-house. But I know for a lot of other affordable housing projects, LIHTC projects, you are not allowed to self-manage what you own. You have to sub it out to a property management company. Those are the rules. So they can't do that. They don't have that control. And so that may be something that you all want to, you know, address.
Great. Thank you so much. I believe we are at time. I am going to look to some of our planners. We have time for one more?
Hello.
One more, okay.
I've learned a lot today, and I really thank all of you. I agree that you should have been first. I'm the Reverend Candy Thomas. I'm the pastor of Christ Congregational United Church of Christ in Palmetto Bay. And I just want to throw this out for you to think about, any of you. You talk about nonprofits and you talk about community. Don't forget about houses of worship in your community. We are usually nonprofits, and our services are usually free to you. I hear about the spiritual component of health, and of course, I believe in that. So remember that we're there to partner with you, and we're free. Thank you.
Well, great. Thank you so much, ladies. This has been wonderful. I really appreciate your time, and I think everyone really appreciates the information that you've been able to share today.
Thank you all, and shout out to the Health Foundation and to Miami Homes for All. Great summit.
I think on behalf of Annie and I want to acknowledge our staff. I'm looking at our staff absolutely worked tirelessly. So Janice, Megan, Lee, help me.
Daniela, Raina, Audrey,
Tanya. Okay, so we don't want to forget anyone. So I just want to say thank you, and I will make a commitment. I'm going to hand the microphone over to Annie. Our vision for this was a starting of an important conversation. And we look forward, the Health Foundation, Miami Homes for All, and many people in this room, we look forward to continuing these conversations. We've inspired thinking, we've been inspired, and we really look forward to what lies ahead. So thank you all for staying until the end. Annie, you've been a wonderful partner always.
Oh, and to the Health Foundation, truly, an event like this doesn't happen unless you have a very strong partner that knows how to do this and that is willing to be on the cutting edge of what their space is. So can you imagine that the Health Foundation is the cutting edge, leading philanthropic organization in this community investing in affordable housing solutions? Hats off to Health Foundation, please, everybody. I just want to say thank you to our sponsors once again, the Knight Foundation, our diamond sponsor, and the Health Foundation, of course, our platinum sponsor, and Wells Fargo, our gold sponsor, and all the others. Thank you so much.
Have a great afternoon, everyone.